Dave Carr, I'm a critical care nurse at one of London's big teaching hospitals, and we're currently in the midst of the COVID-19 crisis, and it's devastating. It's absolutely devastating. I mean, it is heartbreaking to see what's going on inside our hospitals. And I tell you what's really frustrating for us, at the coalface of this is some of the slow response that we've seen from government. Now, in my hospital, we happen to have the right PPE and in intensive care, and it's very clear if we haven't got that PPE, we don't go into the environments. We're not prepared to risk our lives, because we know if we risk our lives, more patients will die in the long run because there won't be the healthcare staff to look after them. But I've just read Matt Hancock's comments about treating PPE as a precious resource. PPE is personal protective equipment for us, so that we as health workers can actually look after the sick and the vulnerable in our society, and they are the precious resource. You are the precious resource at this time being, and so I say to all of you social care workers in Barnet and anywhere else, when you're at your place of work, if you feel vulnerable, if you aren't sure that you're being given the right PPE, or if you're being asked to reuse the PPE, or if you're told you don't need PPE because it's fine, I would advise you to take advice from your union immediately. Our position at the front line is no kit, no care. And I think that's a position that you guys should take up. This virus is lethal. You owe it to yourselves, your family, and to the NHS to make sure that you're protected and you're safe. I'm fuming with the Health Secretary for coming out with comments like that. Fuming. You cannot pay with your lives for the lack of PPE in this country at the moment. They perhaps should pay with their jobs. Good luck to you. Contact your union and don't go anywhere where you don't feel safe.